All right, here we go. Hello, everyone, and thank you for watching this webinar on how to add massage therapy and acupuncture to a chiropractic practice. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, copying of this webinar is illegal. The information in this presentation is for educational purposes. It's not intended to be legal advice. We don't provide legal services. I've made every attempt to make certain the information in this presentation is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get started. My name is Dr. Marty Kotler. I'm a chiropractor. I practiced for many years, 16 years, and about 12 years ago, I started a company called Target Coding. I am also a certified professional compliance officer. I'm a certified coding and billing specialist. I consider myself kind of unique because most chiropractors are not certified coders. Most certified professional compliance officers are not chiropractors. So I take these two areas of expertise that I've created, put them together to help chiropractors, physical therapists, massage therapists, acupuncturists bill better, code better, become compliant, make sure the doctors are complying with all of the laws and rules, and very importantly, make sure you're profitable, maximizing reimbursement, and you're not leaving any money on the table. That's what we do in a nutshell. I've also written books and I've created 11 training videos on chiropractic billing, coding, and documentation. We have a CA boot camp that we put on for chiropractic assistants from front desk to billing and collections to the therapy in the back office. Many doctors that we work with, their CAs are in the back putting the therapies on patients and doing the notes. And then we have another module for CAs in our CA boot camp on how to manage a practice, how to be the compliance officer and manage a large staff. I write articles to many of the publications you probably get, many of the magazines and the journals that you receive, like American Chiropractor, Dynamic Chiropractic, the Chiropractic Economics, the American Academy of Professional Coders magazine. I write articles for all of those journals and newspapers, and I'm a guest speaker at many state association conventions nationwide. By the way, if you're part of a state association that's looking for a speaker on compliance as it relates to billing, documentation, coding, Medicare, HIPAA, let us know. And we normally get a sponsor, so it's a very nice thing for the state associations. They don't have to pay anything and have a good quality speaker. All right, so let's talk a little bit about the pros and cons of integrating massage therapists and acupuncturists. It might not be as easy as you think, and there's definitely pros and cons. There are some, you know, um, consultants out there that make it sound like this so simple, so easy to paint this rosy picture. I don't. I want to share with you. Overall, it's great. Acupuncture and massage therapists and massage therapy. I can't think of too many other services that fit beautifully in a holistic, natural, care-based healthcare center. Acupuncture, massage, chiropractic, beautiful trio of services that work together. So it's a great way, there's pros and cons. Great way to co-treat patients. When I had my acupuncturist in the practice, if I was seeing a patient that just was not getting better as fast as I thought, send them to the acupuncturist, and vice versa. If patient is seeing the acupuncturist not getting better, or maybe I would take care of the neck and the acupuncturist was treating the patient for nausea due to, from pregnancy. So we would co-treat patients. It's a wonderful thing. It adds a lot of marketing opportunities. You're going to get more new patients. The negatives are you're going to need more room. It's going to cost you more if the acus and the massage therapists are employees. You may have to pay for their malpractice. It may cause confusion to your existing staff. How do I know this? I experienced it. Plus, I work with hundreds of chiropractors across the country that are doing this. So I get to, it's like that farmer's insurance. We know a thing or two because we've seen a thing or two. Man, we've seen hundreds, thousands of things or two. So we just pass them on to individuals like you, listening to this for the first time, listening to me for the first time. What you're going to hear is stories. You're going to hear what other doctors are doing out in the field. In my practice, when I brought on other healthcare providers, some staff members quit. They just liked me. They just liked because I was their boss and I was the person that you know, was in charge of their daily duties. And now all of a sudden, here comes a massage therapist, here comes a medical doctor, here comes an acupuncturist telling my staff what to do. They didn't like it. A couple of them quit. That's okay. That's the way it goes. Turnover could be stressful. Next is the setup, the corporations. Hopefully you're in a state that allows you to just simply employ, right? You're the boss, you're the chiropractor, you're the boss, you're the business owner, and you want to employ an acupuncturist, employ a massage therapist. In some states, it's just like employing another chiropractor. In some states, you can't do it. So there's a few options here. So employer employee, that's the easiest one. So you employ the acu or the massage therapist, and all the billing goes out under your name. The employer receives the employer, you receive the gross revenues less the salaries and the taxes and the overhead attributable to the massage therapist and the acupuncture services. Make sure you get an attorney to put together a very nice comprehensive employment agreement. Next, you want to partner. In some states, you can partner with an acupuncturist or a massage therapist and open up an office. That's fantastic. So all the billing would go out under the group tax ID, the shareholders, partners, whatever you want to call it. You all receive compensation attributable to the entire practice based on ownership. So how are you going to set that up? You need a comprehensive operating partnership agreement. I had to do that with my practice. I brought in partners. So if I'm a 70% owner and the massage therapist is a 30% owner, and here comes a check for $100 from a patient or an insurance company, does that get split up 70-30? Maybe, maybe not. It depends on your attorney. And then you could just rent space. Maybe you just want to dabble in this. A few of my clients say, you know what, I don't want to employ, I don't want to, I don't want to get too involved with the acu or the massage therapist. I'm just going to have them pay me rent. Okay, so that's fine. So provide, the massage therapist, the acupuncturist does the billing under his or her own tax ID. The rent should be fair market value. Here's another reason why you'll need an attorney for a sublease agreement. So all these relationships, you need an attorney to create a contract, an agreement with an employer-employee. That's a employment agreement. Partnership, there's a operating partnership agreement, and then if you're going to rent space, a sublease agreement. Next, who can provide services in an integrated practice? Well, yeah, we're talking about massage therapists, acupuncturists. They're considered QHPs, just like you. Chiropractors are considered QHPs, qualified healthcare professionals like medical doctors, osteopaths, PTs. Clinical staff, these are individuals that are trained. They know what to do. Hopefully, you've trained them. Some of them may have a license, but they cannot bill. They cannot bill on their own. That's the big difference between QHPs and clinical staff. You could have a nurse working for you, or a nutritionist, or rehab tech, an aide, but they can't bill insurance companies directly. So make sure you check the rules in your state. Sometimes it's hard to find. That's why our clients say, Marty, I can't get a straight answer from the board. I can't get, so we dig in and we'll find out the answer, but sometimes they're hard to find. Supervision rules can vary greatly from state to state. Check with your state board on the types of qualified healthcare professionals that you can employ. Who needs to be on premises? Who needs to be the supervising provider? Another question we get, Dr. Kotler, we're trying to find acupuncturists and massage therapists. How do we find them? Well, I would start off, just ask your patients. Anytime I needed something in my practice, I asked my patients first. If I needed a landscaper, if I was looking to buy a car or a house, if I had a patient who was a real estate agent, I always ask my patients first. Looking for a massage therapist, ask your patients. Maybe you want to contact local professional schools, local medical offices, PT offices, local hospital. Maybe you want to put an ad in the paper. That's probably the most expensive way to do it, with Indeed.com or one of these other, website for employment. Great places. I've had clients get their acupuncturists and massage therapists off of Craigslist. whatever it takes, right? Um, Placement agencies, that's where you're going to pay the most money. So put an ad in the paper if you have to, great opportunity to work in a state-of-the-art facility. And just some of the things that you might want to put in an ad. We offer competitive benefits and wages, experience desired but not required. Now they might say, well, why would I even want to work for you? Yeah, why would a massage therapist or a or an acupuncturist want to work for a chiropractor? Good question, right? Why don't they just open up their own office? Why don't they just see their own patients, right? Well, maybe they don't want to. They don't want to work. Maybe they only want to work part-time. Maybe they want to work in a group environment. Maybe they don't want to be in a hospital setting anymore. They want guaranteed income. There's a lot of reasons why they would want to work for you. Now, the next question is, do you want to get your massage therapist and acupuncturist in network or out of network? There's pros and cons to being in, pros and cons to being out. More and more insurance companies are paying for acupuncture and massage. You may have noticed that. A lot of wellness services are coming out. Insurance companies want to show that they really care about their members and they want to offer these types of wellness services. Yes, acupuncture is included in many plans now, more than massage therapy as a standalone service. I look at acupuncture almost like chiropractic, 20 years ago. There are many plans that pay for acupuncture, and when they pay very well. I'm going to show you in a few minutes as to what they pay. So, and credentialing. Do you want to get the doctors and the providers in network, out of network? Malpractice, right? That's also an important part of the credentialing process. By the way, I'm not telling you to join any plans. I'm not telling you to drop out of any plans. This is a business decision you have to make. But sometimes you want to get all the doctors in. Sometimes you want to stay out. Okay, so that's a little warm up. All of the things I mentioned to you apply to massage therapy providers and acupuncturists. Now we're going to get right into specifically massage therapy. Now, some of the key points here, there's a big difference between a medical massage, which is something that is paid for by insurance, which is considered medically necessary, and a wellness spa type massage, which is not paid by insurance. Make sure you know the difference. We're going to get into that in a few minutes, but there's a big difference between these two. You don't want to give the impression, or you don't want your documentation and your file to look like it's a wellness massage and you're getting paid by insurance. So make sure you know your scope of practice. For your massage therapist, you might need to get malpractice insurance, verify coverage prior to billing. Some insurance companies, they don't even pay for massage therapy at all. So maybe that's a good thing. Now, here comes a patient that's coming in for treatment. You got to have them fill out forms, right? New patient health history form, a review of systems form, an informed consent, very important. Consent to treat minor. These are the forms that would apply to acupuncture, chiro, massage therapy. Also, your HIPAA forms. Have good quality forms. Here's a sample massage intake form. It doesn't matter. You can get these pretty easily. Have nice, clean forms. Make sure every patient signs a HIPAA notice. This is our HIPAA notice. If anybody wants a copy of our HIPAA notice, just let us know. Send an email to amy@targetcoding.com, and we'll send you a copy of this form. Members of Target Coding, you get this form for free. Yeah, ask a few. Can we, confirm your appointment by email, text, or phone? Can we leave a message on your answering device at home or on your cell phone? Could we discuss your condition with any family members? We utilize an open therapy room. We offer every patient the opportunity to be treated in a private room if requested. So get the forms out of the way. Next, massage therapist is going to do a history. Okay, so massage therapist goes into the room, asks the patient basics. How could I help you, Mrs. Jones? What seems to be the problem? Is it dull? Is it achy? Is it throbbing? Is it burning? Have you seen anyone else for the condition? Basic history. The examination, the massage therapist is going to focus on the areas of muscle tightness and muscle spasm. Pretty straightforward exam, looking for, tenderness and um, soft tissue tightness, hypermobility, hypomobility, muscle spasm, muscle weakness, and areas of trigger points and lactic acid buildup and restricted motion in joints and muscles. Basic massage therapy exam. Massage therapist is not allowed to diagnose most of the time, is not allowed to come up with a diagnosis in most states. So, but the massage therapist may need to come up with a diagnosis. We have like a quick guide. So if you're going to be billing for massage therapy, you want to use soft tissue diagnosis codes. So we have these cheat sheets on the best soft tissue ICD-10 codes. I'll tell you about this cheat sheet a little bit later. And here we go for coding and billing purposes. Massage therapy 97124 is massage therapy. That's effleurage, petrissage, depulpment, compression, percussion. What's the purpose of massage therapy? That's something you should all know if you are delivering massage services using 97124 and you're questioned, malpractice case, I don't know, a state board issue, something's going on where you're questioned, what's the purpose of massage therapy? You should know. It's to restore muscle function. It's used as a preparatory procedure for therapeutic procedures. It's used, we use application of clinical skills when we're using therapeutic procedures, and one of them is 97124. A spa type massage. The patient is just lying there. They're not really doing anything. They're sleeping maybe for an hour with lotions and oils. That's a medical massage. That's a spa type massage. And make it clear to the patient. We would do medical massages in the office, which were medically necessary, paid by insurance. We did them typically pre-adjustment. So before the doctor, me or one of my associates would go into the treatment room, the patient would have a 10-minute pre-adjustment medical massage. The patient stayed dressed. The patient was awake. The massage therapist focused on one body part. During the massage, this is what would happen. Patients would go, wow, maybe to Jessica, wow, that feels really good. Could I get more? So Jessica, we trained our staff. Jessica would say, yes, if you would like a full hour massage, that's for wellness purposes. We offer that during our off-peak hours on Thursday mornings and all day on Saturday. So if you'd like to come in for a full 1 hour spa type wellness massage, which is not covered by insurance, it's $90 per hour. And, some patients said yes, some patients just wanted the little 10-minute pre-adjustment massage. So if you were going to bill for the pre-adjustment massage, there it is, 97124. That's the CPT code. There is a CCI edit. That's why you probably need the modifier 59. Another code that could be billed by massage therapists pretty, logically is manual therapy. That's a soft tissue mobilization, manual lymphatic drainage, manual traction. It's deep soft tissue to help stretch the shortened connective tissue. There's also a CCI edit if billed on the same day as a chiropractic adjustment. Both of these codes, if billed on the same day as a chiropractic adjustment, you typically need the 59. Now this one needs to be in a separate anatomic site. We're not going to get too much into coding. If you have questions on that, let us know. We only have 30 minutes, so it's hard to get too deep into coding. And when you're billing out for the massage therapy services, make sure that the massage therapist NPI number is in 24J. Everybody should be identified in the SOAP note on the claim if possible. The tax ID number should be the same unless the massage therapist is acting as an independent contractor. And typically, whoever's touching the patient, that person's name should be in box 31. Another thing that's good to know regarding massage is getting paid, right? You should have a good financial report of findings with the patient, educate the patient, let them know there's a difference between a wellness massage and a spa type massage. We have excellent forms. This is a form that a patient, comes in with insurance and says, "Oh, I found out my insurance covers massage." Okay, well, we found out differently. And it's a spa type massage, so you might have the patient sign your acknowledgement form that certain things are not covered. This way you're covered. Any type of wellness maintenance service like massage is not covered, even if you're in network with a health plan like American Specialty Health or Optum. Wellness spa type massages are not covered. Make sure the patient signs a form that they understand, and then you could take cash. How about a Medicare patient coming in for a massage under the supervision of the chiropractor? Have them sign an ABM form. It says these are non-payable services when delivered or ordered by a chiropractor or a massage therapist. Have the patient sign the form. It's an ABN. And you just want to have good financial policies to make sure you get paid. The number one complaint that we get here at Target Coding at our help desk from chiropractors all over the country and our paid members is we can't get paid enough. We don't feel like we're getting paid enough for the services we provide. We're seeing more patients than ever, but we're making less money. A lot of it has to do with your financial policies. Have good, strong financial policies. All right, now we're going to move to acupuncture. So acupuncturists, when they bill, many health plans will pay acupuncturists for E&M coding. So if an acupuncturist is going to bill for an exam like a 99203, make sure the acupuncturist knows the guidelines, the E&M guidelines for 99203. There are certain things that need to be documented. I could tell you I have quite a few acupuncturists that I'm working with right now that are being audited, and they're getting paid for exams, but they've never taken a course on exams. They don't know anything about E&M coding. It's kind of scary. And they're billing for E&M codes and getting paid, but their documentation does not support it. So here's how to do it. A little crash course. If your acupuncturist is going to bill for an E&M code like 99203, you have to have at least one chief complaint, 4 HPIs, 2 to 9 systems need to be reviewed, and 1 item from the past family social history. Assuming your acupuncturist is using it's a musculoskeletal exam. If the patient is coming in for nausea due to pregnancy or let's say, asthma, it's a different type of exam. What I'm going through with you right now is based on typical musculoskeletal pain, a musculoskeletal exam. So there's the history review, and then the acupuncturist must do an exam. If the acu is going to bill 99203, you need 12 findings, 12 examination findings. If you can't get 12 and you only have like 6 or 7 or 8, then down code to a 202. You have to code properly. Now, here are some of the things that your acupuncturist will probably want to do. Just general appearance, that counts as a finding, right? We need 12 findings for 99203. So posture, vital signs. Many acupuncturists will look at the tongue, pulse, gait, reflexes, skin. Your acupuncturist could look at the skin. Here comes Mrs. Jones with neck pain and back pain. Your acupuncturist goes to the exam form and writes, the skin of the patient's neck and back appear normal. There's 2 findings. Remember, you need 12. Brief mental assessment. Here's where you're going to get most of your findings. Palpating for tenderness, range of motion, muscle weakness, muscle hypertonicity, and then diagnosis codes. For acupuncturists, you might just want to keep it simple. Most of the acupuncturists that I work with, it's very simple, just neck pain, thoracic pain. Want to get a little deeper and use some radiculopathy codes, that's fine. Many patients see acupuncturists for headaches, very common condition treated by acupuncturists. So let's say your acupuncturist is going to diagnose a patient with migraine headaches. Make sure you know some of these terms, because you're going to have options here with aura, without aura. What's aura? That's that perceptual disturbance. The patient has confusing thoughts, may see strange lights before the headache even comes on. Intractable is what versus not intractable? Intractable, the patient might say, when a patient would come into my chiropractic practice for migraine headaches, one of the main questions I asked the patient was, have you done anything for your headaches? What do you do for you when you get a headache? Some patients would go, Dr. Kotler, I've tried everything. I've tried medication, over-the-counter, prescription. I've tried Botox injections, biofeedback. I've tried everything. Nothing works. What is that? That's considered intractable. So if you're going to use good, strong diagnosis codes like cervical radiculopathy, coming from an acupuncturist, so the acupuncturist should have in the notes patients complaining of pain radiating into an arm. There was a little orthopedic testing done, maybe Jackson compression, foraminal compression, something. Reflexes, remember, if your acupuncturist is getting paid for exams, then the acupuncturist, it's required that the acupuncturist know how to do an exam and know how to document it. That's part of compliance. Sciatica, patient comes in, yeah, acupuncture helps with sciatica terrifically, tremendously. But what the notes have to say, how do you lead up to it? Patient's got pain and numbness down the leg, Vector, got to do straight leg raise, neurological testing, palpatory tenderness. Patient comes in with carpal tunnel syndrome. Have the acupuncturist hopefully the acupuncturist knows, what the syndrome is and what ortho tests to do, and maybe refer the patient for, some neurological test, EMG, NCV. Tennis elbow. Oh yeah, this is a page out of the book that I've written on the best CPT and ICD-10 codes to maximize reimbursement. In chapter 3 of the book, I have I think it's about 25 of the most common diagnosis codes and how to justify them, how to prove that what you came up with was logical. So cervical brachial syndrome, Wright's, Atson's, diminished reflexes. Cervical sprain, there should be some restriction and tenderness. Soda Hall may be positive. Now let's talk about the acupuncture codes. 97810 is acupuncture, one or more needles, without electrical stim, initial 15 minutes of personal one-on-one contact with the patient. 97811 is additional 15 minutes of personal one-on-one contact with reinsertion of the needles. 97813 is with electrical stim initial. 97814 is with electrical stim, each additional 15 minutes of one-on-one contact with reinsertion of the needles. So that means you got to take the needles out and put in new ones, not the same ones. There's also a HCPCS code. Most doctors that I do this presentation for never heard of S8930. This is electrical stimulation of the auricular acupuncture points, so it's in the ear. Each 15 minutes, personal one-on-one contact with the patient. So you want to verify coverage before billing. Review the health plans. I'm working with an acupuncturist right now. His notes were requested by an insurance company. His notes are not good. I asked him, have you ever read the policy from the plan that you're billing? No, didn't even know it existed. See, that's not compliance. Compliance is understanding the entire picture. Patient financial obligations and, the forms made to be very clear. Now this comes up, the dry needling. Dry needling. A lot of chiropractors are doing dry needling. Some states it's not allowed. Some states it's not appropriate. Most states do allow dry needling. Many physical therapists do dry needling. Some acupuncturists do dry needling. So what's the deal with dry needling? At the present time, there is no specific CPT code for dry needling. So be careful. Many seminars out there and many doctors and acupuncturists are billing 97140 for dry needling. No, don't do that. And if you don't believe me, in essence, that you shouldn't do it, right here. This is an official statement from the American Physical Therapy Association that says dry needling should not be billed with 97140. Now, there is good news regarding dry needling. We're going to be getting an actual bona fide valid CPT code next year. Next year, we will have a CPT code for dry needling and laser. There's going to be codes for two services that some of you are providing. So I don't know if that's good or bad. We will find out soon. So now a little bit more about the codes. The acupuncture codes include a little pre-service greeting of the patient, intra-service, and post-service. Can't bill extra for that. Acupuncture is reported based on 15-minute increments of personal face-to-face contact, not the duration. I'm sorry. The 15-minute increment is defined as personal one-on-one contact with the patient. This means that the acupuncturist is in the room with the patient, actively performing activities that is a component of acupuncture. And your E&M codes, like your re-exams, 99213, 203, they can be billed on the same day as acupuncture. So what's included with this 15-minute increment? Because some acupuncturists say, Dr. Kotler, wait a second, I put the needles in and I walk away for 15 minutes and I come back and I take them out. That's not okay. According to the CPT guidelines from the American Medical Association, no. You're supposed to stay in the room. And here's a few of the things that you can do. Chart review, discuss with the patient the results of the last treatment, examine the pulse, tongue, skin, ears, hand washing, finding the appropriate acupuncture points, manipulating the needles, removing the needles, reinserting the needles, disposing of the needles, documenting what happened, counseling and coordinating care for future services. Those are the things that are done typically in a 15-minute interval. Here's a sample acupuncture note. It's a basic note, and I like to have at the bottom discussion with the patient, the 30-minute included, palpating, the removing, patient improving as expected. There's the complaints. Now, there's something that you should have when you're bringing on other healthcare professionals, especially if they're going to be employees. Most of the doctors that I work with, chiropractors that I work with, that bring on massage and acupuncturists, employ them as employees. They're not independent contractors. So that's why it's important to have a billing and coding policy manual for your employees. Here, for staff, it's actually for three reasons. For staff, your staff want organization, leadership. They want to see that you are creating a culture of compliance. If you have a staff member that is accusing you, the business owner, of any wrongdoing, this billing and coding policy manual can contain the ammunition to defend any alleged misconduct. It's also good for the providers. It's good for insurance companies. Why? Because insurance companies can audit you. Here, this is a letter to a provider for acupuncture. Cigna wants $250,978 back. Wow, that's not even my biggest one. I am working with one doctor, one acupuncturist. Insurance company wants $660,000 back. So a billing and coding compliance manual could help mitigate the fines. This acupuncturist was billing E&M codes incorrectly, billing for diathermy and manual therapy, didn't document the start and stop times, the type of manual therapy, the acupuncture. There were multiple examples of conflicting information with respect to the time spent treating the patient. 42% of the claims had no supporting records at all, so this doctor got beat up pretty badly. Want a lot of money back. Now, some plans pay very well here. It's possible, if your acupuncturist is billing for maybe 1, 2, or 3 units of acupuncture plus some manual therapy and an exam, you can get paid $300, $400, $500 a visit. It is possible. Some plans pay very well for acupuncture, but you want to be careful. You want to make sure that you are proactive. Insurance companies want doctors and acupuncturists and massage therapists to be proactive when it comes to billing and coding. What does that mean? Having written policies and procedures. So we recommend creating policies and procedures. If you have an acupuncturist, have a simple billing and coding policy manual just for your acupuncture services. Make sure all your billing staff know that you do things right, just in case there's an episode, just in case there's an issue, and now your loyal staff members are deposed in a lawsuit, that you want them to be on your side, right? Because they've been following all the things that you do, like you perform regular staff trainings and you do record reviews. Here's something that you should be doing for all your patients, especially the ones if you're billing a federally funded program. Do internal record reviews. Here's another policy on staff training, 3 hours per year. Many of you listening to this right now, that if you want a certificate of attendance, it's something that you can prove that you attended a billing and coding webinar on acupuncture and massage therapy, we'll send you a certificate. We'll see when you logged in through our platform, our GoToWebinar platform. We'll see when you logged in. If we feel that you've logged in for a certain amount of time, we'll send you a certificate. That's proof. Now you have proof. You'll have something in writing from us that you attended a billing and coding webinar. 3 hours per year. How about background checks? You want to do a background check on your acupuncturist or your massage therapist? Certain things need to be done. You know, with a federally funded program, you have to go to the OIG exclusions list to see if the provider or the staff member has been excluded. Like if you wanted to hire Dr. Godfrey to be your associate chiropractor, sorry, you would not be able to have him treat your Medicare patients. He's excluded from the Medicare program right there. Exclusions list. So have policy. What's your policy on collecting copays, deductibles? You may have patients coming in getting an hour of massage, and you're telling the patients, I know this happens, don't worry, Mr. Thompson, you don't have to pay us anything. We'll accept your insurance as payment in full. Just lie down, get your 60-minute massage, and we'll see you next week. Oh boy, that could be a problem. This is a doctor that got a request for not only records, but it says we want to see copies of patient billing and collection ledgers. We want to see documents that show when bills were sent to the patient, if any, and how much was paid by the patient. Oh boy, this is a problem. What's your policy on the Stark and anti-kickback laws? Pretty simple, right? You're going to behave. You just read these policies and move on, make sure everybody understands them. Can't refer patients to another facility that you have ownership in for certain designated health services. That's the Stark law. I'm not a lawyer, but that's pretty straightforward. Anti-kickback, you're not supposed to get paid for referrals. That's a classic anti-kickback, so read that, understand it. Do you have a policy on maybe giving patient discounts? Say your normal fee is $100 and a patient comes in without insurance, or they have a huge deductible. You want to give them a discount? Yeah, you can. How much? So this talks about how much discount you give. What about free exams? Get that question all the time here at our help desk. Dr. Kotler, we want to offer a free exam to all patients, or normally $300, now it's only $75 for an exam and x-rays. What's your policy on that? Do you do it? I'm not a fan of giving out free services, but if you want to, make sure you're following all the rules so you could swan. You ever hear of that acronym SWAN? You want to be able to swan, which means sleep well at night, SWAN. So knowing the rules, knowing the policies, this doctor is not swanning. This doctor got in trouble. This is a serious problem. This doctor from Iowa was giving his Medicare patients free electrical stim. He got fined nearly $80,000 for giving away free stim to his Medicare patients. Don't do it. It's not worth it. So just the essentials, you know, have a compliance officer, have forms, employee policy forms acknowledging that they know what your office is all about, who has access to your computers, training logs. A little bit about HIPAA, because you're going to have massage therapists now and acupuncturists in your practice. They're going to be able to see patient health information, right? So that's HIPAA. HIPAA is all about protecting patient health information. Has nothing to do with billing and coding. So are you a covered service? Probably. If you bill or receive insurance companies, a payment from insurance companies, you're covered. You submit claims electronically. If yes, you're a covered entity. By the way, we have a ton of HIPAA clients that we work with. If anybody would like a reference, we can give you the name and telephone number of a few of our HIPAA clients, and they're happy to discuss with you how it worked for them. Are massage therapists and acupuncturists considered business associates? That's another HIPAA item. Well, what's a business associate? A business associate is any individual or organization that's not an employee that has access to your patient health information. Wow. If you have an independent contractor coming in, like a massage therapist and acupuncturist, they can now see your patient health information, get a BA signed, use a billing company, get a business associate agreement signed. You use, outside DME company, to do your back braces or TENS machines, get a BAA. Collection agencies, transcription services. Ready? Here's a question, little pop quiz. If you receive a suspicious email directing you to a link, it is best to hover over the link first to see where the address leads. True or false? So now I'm relating this. You have an acupuncturist or massage therapist in your practice, and you have a desktop computer that they are getting emails and sending emails. How is that computer protected? Does that computer have access to your patient health information? What happens if the massage therapist clicks on a link and now you have malware software that has come into your system and shuts your whole system down? Do you have backups, right? The answer to this is true. Here, I recently got an email from Netflix. I love Netflix. It says your account is on hold. My initial reaction is, what? I got to be able to watch Netflix. It was a scam. I took a picture of it. It says, hello, we're having some trouble with your current billing information. Yeah, really. We'll try again, but in the meantime, you need to update your payment system. And that update account, I hovered my mouse over it. It didn't go to Netflix. It was a scam. It says, your friends at Netflix. Oh, really? They're my friends? They're trying to take me down. So if you're looking to get involved with HIPAA, not looking, you have to. You don't have an option. So start looking into a HIPAA program. This is a big problem you will see in every chiropractic magazine, journal, newsletter. State association is going to be putting out tons of stuff. You're seeing it already on HIPAA, on compliance, just general compliance. So you want to get compliant. Just a few closing comments. I'll close with I have a 9-step action plan, and then we're going to get to questions and answers. Step 1, get proactive. Don't wait for the oil light to flash on your dashboard. Get out of the car, open up the hood, get proactive. Put a HIPAA program in place. Don't wait to get pulled over by the HIPAA police. Put a billing and coding policy manual in place. Review the policies. Here, wait, I'm jumping ahead. Step 2, get all the forms signed. That's for staff. Step 3, acupuncturist, massage therapist. Before you start working on a patient, review all the new patient paperwork that the patient filled out prior to treating the patient. Step 4, review the policies from the companies you bill the most. If you're getting paid $500 a visit for your acupuncture services, don't you think it would be a good idea to do a deep dive into the plans that are paying you and make sure? Some plans say we don't pay for pain. What? Yes, some medical policies on acupuncture will say we'll pay for um, knee problems, but we won't pay for neck pain. We'll pay for nausea due to pregnancy, but we won't pay for asthma. You know, check the policies. Step 5, understand the what and the why. Your CPD codes are what you're doing. Your diagnosis codes are why you're doing them. Make sure that they combine. That's like a little buddy system. Do a self-test on your SOAP notes. Make sure you know what the insurance companies are looking for if you're billing insurance. Step 7, always keep learning how to help your patients, how to improve your business. Step 8, put together a billing and coding policy manual. Step 9, regular meetings, very important with your staff, especially your staff that are doing your billing. If you're using a billing service, by the way, Target Coding now does billing. We just added that recently. So if you're looking to use us for billing and collections, outsourcing your billing, if you're having a lot of staff turnover, it's just a pain in the butt to keep hiring and firing and hiring and firing, outsource your billing to us. So if you're using a billing company, do a spot check. See if they are doing what you tell them to do. I'm working with two doctors right now that are being audited. The billing company was adding the 5-9 modifier. The doctor didn't even know. Another billing company was upcoding, changing the CPD codes and diagnosis codes. Doctor didn't know. You want to do this, right? So you can what? Swan. All right. Just a few other closing comments. Please check with all the plans you build to ensure it's compliant. We can't guarantee this information will guarantee payment from any insurance company or patient. And you know the rules and laws change all the time. Do your best. Stay on top of these changes. Attend seminars, webinars. Join your national and state professional associations. So I want to thank everybody for attending. Here's my contact information if you would like to set up a free consultation. We offer free 15-minute consultations on anything you want to chat about. You have a particular issue you want to talk about, you want to talk about our services that we provide, you want to talk about American Specialty Health, you want to talk about the pros and cons of being in network, out of network, you want to talk about staff hiring, you want to talk about DME, you want to talk about stem cells, PRPs, physical therapy, acupuncture, massage. Set up a 15-minute consult, no charge. There's the email, website, telephone number, fax number. I'm going to get to questions and answers. Oh, by the way, besides these webinars, Target Coding offers products, training manuals, books, forms. We offer services, audit prevention. We do on-site trainings, one-on-one consulting, compliance such as Medicare and HIPAA. We install them into your practice like we're installing a kitchen sink. We'll install a Medicare and HIPAA program. We have memberships. We have many doctors that like to have us at their disposal, so to speak, every month. I have some clients that I speak to every day. I have some clients that I never speak to, but they know we're there. You could have access to our 21 videos in our member-only section of the website. Forms, books, letters, trainings. That's our membership. And we do seminars all over the country, obviously webinars. This is something we're doing a lot now because many providers, especially New Jersey, those of you listening to this from New Jersey, you may have heard that Horizon Blue Cross Blue Shield has teamed up with American Specialty Health, ASH, American Specialty Health, also known as ASH, to manage your claims. That's going to be a big change in New Jersey, January 1st, that's coming. You may want to learn how to deal with ASH in network. If you're a typical provider in New Jersey, Horizon Blue Cross Blue Shield was pretty straightforward. It's going to change. So do you want to get more visits out of the insurance company? We'll show you how to do that. Do you want to get more cash out of the patient? We'll show you how to do that. That's what we do in the training. We cover both angles, how to maximize insurance reimbursement through ASH and how to get patients to pay out of pocket. You shouldn't be sending in your SOAP notes, by the way. I don't know why some doctors are sending in their SOAP notes to get their services paid or approved. That shouldn't be happening. So this is a live training for your office. You pick the date and time. It's not a webinar. Like right now, we have hundreds of people listening to this webinar right now. The ASH training is one-on-one. Doctor, go get your staff, a whole bunch of you, crowd around one computer and watch me do a training. It's interactive. Tell me what's happening in your practice. The next is compliance. Compliance, we have something called our chiropractic compliance program, and it's composed of the big three, I call it HIPAA, OIG, and OSHA. HIPAA is also OIG is also considered billing and coding. So HIPAA, billing and coding, and OSHA. Those are the three federal and state requirements for every chiropractic practice in the country. So do you have any of these installed into your office? Do you get HIPAA headaches, OIG procrastination, OSHA indigestion? I love these flyers. So outsource all of that. You want to get rid of this headache? I'm telling you, all of the journals, magazines, everything you get regarding, chiropractic, the business of chiropractic, from all the, American Chiropractor, Dynamic Chiropractic, chiropractic products, all the magazines and journals, all your state associations, you're going to see a lot of information on compliance. It might make your head spin. You want to just alleviate all of that? Outsource it to us. $199 a month. We will take care of all of your compliance issues. We will do most of the heavy lifting. Now, it doesn't take a year. Some of our offices, they're quick learners. We're done in a couple of months. Some of some of our clients, even after a year, they're still struggling, but most do it pretty quickly. This is the book that I wrote on the best codes to improve reimbursement. Some, the diagnosis codes I was mentioning. It shows you how to code pair. Like food and wine, you should be pairing your diagnosis and CPT codes. So for example, patient comes in with cervical radiculopathy, pairs beautifully with mechanical traction. Yeah, a wine and food expert master is called a sommelier. I've labeled myself a coding sommelier. I will show you how to pair your CPT codes and diagnosis codes to maximize reimbursement. For example, if you bill 97110 therapeutic exercises, I'll show you all the diagnosis codes that pair beautifully with that procedure code. So that's in the book. We also sell a whole bunch of forms. I don't care if you're using ChiroTouch, ACOM, Eclipse, Genesis, you still need forms. You need HIPAA forms. You need letters of medical necessity, fight back letters, ABN forms, new patient health history forms, lien, letters of protection, authorization of assignment, review of systems, financial policy forms, consent to treat minor. What happens if the checks are going to the patient? You're out of network and the checks are going to the patient. Is there a form that could ensure that you get the money? Yes. Attorney asks you for records. What do you write back? You need an ASH re-exam form to get more visits approved. You want to see a whole bunch of sample soap notes? Check out, I've written probably about 500 forms and letters and templates over the last 12 years. I've taken my 75 greatest hits, so to speak, and I've put them into this package. You can get them on the website. When I speak to doctors and our staff speaks to doctors, one of the most common things that we hear is, I want to make sure I'm compliant. But compliance is like a lot of things, billing, Medicare. Typically the doctor goes, oh, no, I want to have compliant soap notes. I want to make sure my notes are compliant. Oh, that's billing and coding compliance, no problem. Bring them in for a checkup. We'll review your notes. We have a 5-chart review product. We'll help you get proactive. We'll help you find money that you're leaving on the table. How do we know? Again, we've seen a thing or two. That's why we know a thing or two. We've been doing this for over 12 years. We've had a few doctors, just by adding one CPT code, they've added another $10,000 of income to their practice. So we have a comprehensive chart audit and fee schedule review. And then we have 11 videos right on our website that you can buy. Let's see. All right. So now I'm going to switch over to questions and answers. Let's see one more time. Here's my contact information, Dr. Kotler at targetcoding.com. Website, targetcoding.com. Telephone number. There's our HIPAA secure fax number. So if you wanted to send us a SOAP note to review, you don't have to white out or black out the patient names. We have a HIPAA secure fax number. So email us. Set up a free consultation. All right, let's see what questions have come in.